For the past few years, Haiku has worked in partnership with local schools in Kailicha, local Tvets in Tvet College in Pinelands, and Falsbeck College in Muizenberg to develop and implement peer education programs for young learners.
Haiku also run a co-curricular project where we select and train peer educators to give workshops around intersectional issues of race, gender, HIV and sexuality. And the peer educators do workshops in Orientation Week, and we also work with programs such as the Dell program and such as the MasterCard.
Even though I'm doing medicine and we get taught about HIV and AIDS, but some of the things you never get taught about. For example, they can teach you what AIDS is and how to treat it, but they never teach you how to interact with someone who has HIV outside the consultation room. So being an ace for me, initially I thought it was just gonna affect me as a student, but then I've realized as the years gone by that it actually didn't just help me as a student, but it helped me grow towards my friends and my family as well. So the skills that I learned during an ACE, like conversational skills and non-judgmental approaches, and also with issues such as gender-based violence and gender-based issues, I became comfortable now in engaging with people. So not only people on campus, but also people at home. When I go back home, I'm able to have these chats with people and educate people.
Just remember, you're the peer educators. So we had thought we would share with you the training presentation we did for them. So obviously I'm not training you guys in counseling skills, but to try and give you a tool that you might use on your students if you consider peer counseling. And for us to try and share, this was the first year we did it. So we've only done 1 year of it. And to tell you what we learned and see if that might be something that would be useful for you. We also tried to look for very accessible resources where we could give them health promotion training around depression, anxiety, etc. Because we knew even if they're only coming because they want it on their CV that they're a counsellor, they also are going to have their own anxiety and depression. So it was a way of getting resources out there because they might not come for a anxiety or depression workshop because of the stigma and so on. So does that sound okay? Is there anything anyone wants to add to the exhortations?
So the first part is really around looking at some of the models that we've used, and then we wanted to break into the two separate areas that we specifically want to focus on in terms of the preparation for February, and see how we can start the process of brainstorming what are the components that we would train the peer educators in February. And I think that's what the move is.
I found your session really useful because it was also just like a refresher for me of the techniques to use with students.
Also, some of the techniques that you presented today got me to think, because it's some of the techniques I wouldn't have thought of. So it provided me a good opportunity to perhaps go back and do my own homework around focusing more on relaxation techniques, as well as cognitive restructuring or reframing. I think it's something that I perhaps need to work on. But I definitely enjoyed one of the topics that I tremendously enjoyed or took away from was the self-compassion.
Good.
And the drawing. So just tying that up, and I think the self-compassion is something that I feel is not often focused enough on.
Also, what I also always find helpful is to experience it myself, because it gives me some insight into the challenges that participants might have when you are running this type of training or facilitation. Because sometimes you will see resistance or rolling of eyes and things like that, and it just puts it into perspective for you, because some of the exercises were easier for me to engage in than others. So that experiential part was good. And
it was really insightful, and I like the drawing part. And I think I would really use that if I would be in a counseling session. For me, it helped. Yeah.
In the Faculty of Science, Haiku works with the environmental and geographical science students in third year and master's level, and we apply the concept of community adaptation and methodologies to the issue of climate change and vulnerability. And again, this process is very important because the methodology is based in the social sciences. The focus is on engaging with communities to understand land hazards, environmental hazards, how the community's practices are adapting to weather and flooding or sanitation, waste. And the students then use this methodology that we teach in the classroom in the communities that they want to learn more from. The process is very important because the students don't have a once-off engagement. Following the input they receive from the farmers or the community members, they then conceptualize or analyze the data into a research report, and then that is taken back into the community, and so that practice is shared, and that the community can learn from this process.
Results from the 5-point Likert scale completed by the False Bay College staff indicate that they're very satisfied with the training, implementation and partnership they've had with the Haiku staff over the past few years.